to host tonight's event and be round the table, the Zoom table, with some excellent activists and speakers from Scotland, England, Ireland and Wales. As someone who's worked in the NHS as a nurse for most of my career, I'm delighted and looking forward to the conversations that take place tonight, including questions from our members that have already been submitted ahead of the call. A warm welcome is extended to UUL's candidate for the next Unite General Secretary election, current Assistant General Secretary Howard Beckett, who also joins us on the call. Thanks for taking time out to do this, Howard, really appreciate it.
Not at all.
We look forward to the contributions throughout the call. The aim of the health rally is to look at the current impact of COVID on health staff and looking forward to what we can do to mitigate some of the impact on staff. A year into this pandemic, we want to look at what does health staff look like, what are the resources looking like, and what are the risks. We want to look at how this is impacting on staff, their families, and we also want to kind of look at whether there's a clear plan across health boards in each of the countries. We know we're now at the stage of vaccinating, but this brings with it a lot of concerns. Will the inequalities gap widen? You know, will the distribution and implementation of the vaccination programme be equitable? And how is this going to look post-pandemic? And do we have a clear plan to safeguard staff and for all of the health boards to work with the trade unions to anticipate the changes needed to emerge from this stronger and intact? There will be some differences across Scotland, England, Ireland and Wales, but there will also be commonality, and that will be helpful for the panel to share and highlight some of that. The event is going to last roughly an hour, so we hope we can pack everything into that hour. It will be streamlined live across Facebook, Twitter and other social media links, so please listen in, please share and please contribute. Let me now kick off the event by asking each of our speakers to give a short introduction of who they are, where they work and their current position or role, as well as perhaps two COVID priorities for their members or their geographical region. Obeida Ahmed will join us slightly later as she's working as a pharmacist till 7 o'clock. After the introductions, we'll then move to some questions. So first of all, could I just move to Marie, just to kick us off, Marie, where you work and who you are and what your job is?
Hi everyone, my name is Marie Casey. I'm a healthcare assistant for the past 38 years. I work in intellectual disability residential care in the south of Ireland. And I suppose as regarding vaccine, we are not on the table of immediate rollout as yet because we're termed as long-term residential care workers as opposed to frontline workers. That's about it. COVID, we did very well in the centre I work in, and in general in the south we did well, but since Christmas, like everywhere in Ireland, COVID cases have just escalated beyond coping. So we're on the big fight all the time.
Oh, thanks very much, Marie.
No problem.
Yeah. Ewan, could I go to you next?
Yeah, evening all. I'm Ewan Hope. I'm the chair of the Scottish Risk. I'm also a member of the National Industrial Sector and a member of the Scottish Executive. My day job, I'm classed as chair of staff side for NHS Years and Ann, so I take that role. I suppose my main concerns are the staffing pre, during and post-COVID, and also how that impacts in our members. So if you go back this time last year or just slightly before, the media was showing the ambulances queuing up outside A&E, and that was just systemic of an underfunded health service, lack of staff, both in-house and also our social care staff. You fast forward and you put the pandemic into that, so our members were coming out a really, really difficult winter. They were looking to have some downtime, if you like, and then they're hit with a pandemic, asked to cancel annual leave, and that was a huge impact on the staff. When we did our pay survey, we thought that the number one priority was obviously going to be wages. The reality was it was about the amount of excess hours and overtime they were working, the impact that had on their families. And the reality is when they did get time off, when they went home, they were either so anxious, stressed, fatigued, that quality time with the family just didn't exist. And rather than having quality time, there was tension. So you fast forward that and look, you have to remember that was during the first wave, when we had loads of volunteers, we'd emptied the hospitals. Things weren't just quite as bad as they are in this current wave. So 10 months later on, we're asking staff to cancel annual leave yet again. They've been in a winter period for 14 months. The fatigue levels are increasing constantly, as is the anxieties and the stress. Because in the first wave, they were wary of what was coming over the hill. Now the fear is they know exactly what's coming over the hill and how difficult it is. So if we put all that into the mix, staff are getting more and more tired, less and less staff, more and more patients. The skill mix is off the chart. I've heard anecdotal of 2 trained nurses looking after 30 patients. That's no good for the patients, but it's certainly no good for our members. So if you put all that into the mix and the high prevalence within staff groups, I mean, you're looking at 16-17% infection rate. So there's something seriously wrong. My opinion is we're so short-staffed, so many patients, so tired staff that mistakes are starting to creep in. And that gets onto that blame culture you spoke about, Anne. And that's a thing we need to look at. But also, I don't think that's been properly investigated, and I don't think it's properly reported. So they're my concerns going forward for the health service, but particularly for our members. Thank you.
That's great, Ewan. Cheers for that. Just on that, the infection rate, Ewan, can I just ask, has that exponentially gone up? You said 16% there, didn't you?
Yeah, that's an average across the whole country. So
Okay.
The reality is, in the first wave, it was a lot lower than it currently is, because the reality was we took most of the other patients away from the acute settings. When you put them all into the acute settings, you'll get red zones, green zones, but the reality is most wards have got COVID positive patients, and therefore that cross mix, and that's which in my opinion, is leading to higher prevalence. Plus, staff are getting tired and they're making mistakes. It's just a part of life.
Absolutely. Thanks for that. Stephen, can I come to yourself?
Yeah, thanks, Anne. Hi, folks. I'm Stephen Lindsay. I'm the Vice Chair of the Scottish Health Risk, so support Ewing in that committee. And my day job, I'm a partnership rep within Grampian Health Board up in the northeast of Scotland. And I guess the issues that our members are facing up here is, a lot of fear, a lot of concern, a lot of questioning where the advice is coming from for various decisions. So and that's really broad ranging. It's everything from who's making the decisions and who's providing the expert advice on the different types of PPE that have been used. Because if you look over the 10 months of the pandemic, the type of PPE has changed, and the advice on things like eye protection has changed numerous times, and each time the advice changes, confidence amongst the membership goes down. There are similar issues with the whole thing of the vaccination, particularly with the change by the this joint committee of vaccination and immunisation on the timing, the scheduling of the second dose of the Pfizer vaccine. Again, lots and lots of fear, lots and lots of concern. So as activists, as workplace reps and as health and safety reps, we're getting questions day in, day out from members who are, as Ewan said, they're tired, they're incredibly tired, they're stressed, they're anxious, and they're scared. So it's about trying to deal with those fears and challenge when you can challenge, and try and help calm people down as much as possible.
Thanks very much, Stephen. Excellent. Alison, can I come to yourself next? You're in Wales. Tell us a wee bit about your end.
Yeah, hi, I'm Alison Pawley. I sit on the Regional Committee for Wales, the Health Risk, and I'm Branch Secretary for Unite at Betsy Cadwallader, and we're the biggest health board in Wales. We're up in North Wales. I think for me, really, following on from what Ewan and Stephen have said, definitely the PPE situation has been very confusing all the way through. At the beginning, we didn't know where the PPE was coming from, when it was coming, what it would be, how long it would last. Even though we sort of reached a bit more of a static situation, as Stephen said, staff are confused. If we have new masks, we're running out of one mask. We've got to be fit tested for the other mask. It just doesn't instill confidence in people, and obviously it's causing more stress. Up in Wrexham, we've had a really, really bad spell, which is where I'm based, up in North Wales, of COVID incidences and of our hospitals being full and us having to cancel, elective services. What worries me really is when we start to go back to some sort of normal, and people who have had their operations delayed, how much harder it's going to be to pick that up. Going forward with their treatment, their situation may not have been as serious before, but now it is, so that's going to put more pressure onto our services again. And that's really, really worrying. And I know staff are worried about that already, so we're already thinking about what it's going to be like when we do go back to anywhere near normal. Yeah. With the vaccination thing again, is the change in the with the Pfizer vaccine. Between the first and the second vaccine, it's really worrying. We had staff that have had their vaccine before Christmas. Now they were expecting it in January, and now they don't know when they're going to have it. So it is really, really worrying.
Mm-hmm. As you say, Alison, the concerns about those that are not being seen now, and the kind of waiting list, and especially really serious cases of cancer, etc. And you know, it is a big worry for staff. So. Yeah. Obeda, welcome. Right, you finished your shift now?
I am, yes. Sorry, everyone. Hi.
That's fine. I'll give you a minute to catch breath. And welcome, Professor Kailash Chand. Nice to meet you.
Thank you, Anne. Thank you very much.
Yep.
Before I give my introduction, allow me just to pay tribute to Captain Tom King. Tom King, I think, in my view, was a symbol of optimism, resilience, whatever you say. And the way he boosted NHS when NHS was in doldrums is lesson to anybody and everybody, that you can do anything for the community, irrespective of your age, where you live, and what you do. So hats off to him on behalf of NHS family, Unite, and Unite Doctors, which I'm a very proud member of, Unite Doctors for several years. As far as I'm concerned, I'm Kailash Chand. I came to this country in 1978. So I have worked in NHS for almost 42 years. My introduction to politics was courtesy of Margaret Thatcher's fund holding. If you remember, there was a fund holding, and that was essentially the so-called introduction of private sector into the NHS. The two-tier NHS was actually brought on by Margaret Thatcher. And I think that was brought me into the politics. And since then, in medical politics, I played my role, my part, whether it was Tony Blair and Alan Milburn's bringing in private sector, or it was Cameron and Lensley, and now great Johnson and Matt Hancock. Where they try to really finish NHS off is something which worries me all the time. And we know what COVID has done to NHS staff and NHS family. If I remember correctly, to date, almost 52,000 NHS and social care workers are off sick with COVID. Almost 900 people have died. And quite a bit of people who have died are from BAM community. And as you know, I am an immigrant, and as an immigrant being perhaps the backbone of NHS, and we perhaps neglect them. So I keep on raising my voice for their rights as well, the kind of discrimination they face, and hope. My real worry is, to be honest, and is NHS was broken before the pandemic. And during pandemic, it's just the goodwill of NHS staff, which is let it going and moving. And once it will definitely be over one day, COVID, what will remain of NHS is a real worry. And I think prior to pandemic, we were 100,000 staff short. That included 40,000 nurses, 10,000 doctors, and all of the staff. And that gap has gone bigger, not gone less. And you know, 4.5 million people are now waiting. Almost all non-COVID diseases are on the back burner. How NHS is ever going to come to normalcy is a million-dollar question for everybody. I think we really got to work and stand up and tell this government that NHS is our soul and you can't mess up with soul. And we got to save our NHS. Thank you. I think I've gone enough on this.
Thank you. I think you've highlighted exactly what some of the panelists have been saying. Ewan mentioned it, Alison mentioned it, so did Stephen. Pre-COVID, actually, things were really concerning pre-COVID, and now we've hit a massive pandemic. So not only the current situation is a worry, but post-COVID is a real concern. Obeda, can I come to yourself just again, a wee bit about who you are, where you work and what the issues are in your area?
Hi, Anne. Hi, good evening, everyone. My name is Obeda Ahmed and I'm a community pharmacist. So brief insight to the life in High Street Pharmacy. And as you can imagine, this year has been the craziest year we've ever experienced. I've been a pharmacist for 13 years. I've never known it like this. At the very beginning of the pandemic, we were completely inundated with prescriptions and requests to purchase every medicine possible over the counter. GPs were unable to see as many patients. We had huge queues of customers coming to collect prescriptions from us. We simply couldn't get the medicines out fast enough. With no access to PPE, no knowledge of what was required to protect us, we ploughed on, doing the best we could. We received mixed messages of the benefits of PPE, clearly trying to cover the lack of supply to meet the demand. And it wasn't until well into September when we were actually provided with sufficient PPE for our staff and explained how and what was required to protect us and hundreds of customers we face on a daily basis. Now, when I think of the number of cases that continue to spread and cause the fatalities in the first wave due to the lack of PPE, it breaks my heart. Why, in a country as advanced as ours, will be so late to react? And still the heartbreak continues. Why the cases continue to spread, the fatalities are continuing to rise, all because we've got a government who does too little, too late at every possible point. The only glimmer of hope and exit out of this pandemic now is with a successful rollout of the vaccines. And for the last few weeks, I've been very fortunate to be part of the nationwide vaccine rollout. It truly is an honour to provide a service that will hopefully save so many lives and prevent serious illness and hopefully get us out of this awful pandemic. As many of you will see when you are called for your vaccines, the centres are very organised and efficient. They really are very impressive. It's amazing what our NHS can achieve without the input of private donors indeed. The centres have brought people from all areas of community healthcare together under one roof to work side by side, socially distanced of course, but a new and a great way to work together, which will hopefully benefit all of our community. My only concern now is with the vaccine rollout is the decision to delay the administration of the second dose. I can see the attraction in us getting as many people some form of protection as possible with the first dose, but I worry that we are using the vaccine outside of the way it was trialled and the recommended doses. I also worry that people will get a false sense of security with the first dose and not follow the social distancing and other guidelines that they are needed to do. We hear of new strains and a virus that is mutating, naturally, as all viruses do, I guess. But the last thing we all want is for the virus to become resistant to any of the vaccines. And in my humble opinion, we should be vaccinating as per the recommendations of the manufacturers and hence the licensed use of the vaccines. But look, there's been a great effort to get the vaccines developed and rolled out in such a short time. And there's finally something to be hopeful about. And I'm going to leave it there. If there's any questions later, I'm happy to take them.
That's great, Obeda. I think we'll definitely pick up on that point about the second vaccine when we get into some of the questions, because they were submitted by some of the members. That's excellent, Obeda, thanks. Howard, just over to yourself, given the initial concerns across all the countries, what are your initial thoughts or any comments at this stage?
Thanks, Anne. As for those who don't know me, I'm an Assistant General Secretary in Unite, and thank you for everyone for joining tonight. And I'm doing really a listening exercise in respect of members' experiences at the front line. But for those watching, you are going to hear about experiences in different nations across all of the British Isles. Marie is obviously fighting for a free healthcare service in the Republic of Ireland, and you'll hear about the fact that we only had one private hospital that was taken into public ownership at the time of the first wave. And then here we are with our systemic problems with the NHS that have been caused by decades of a neoliberal approach. And in reality, what we're seeing now is the marketisation of the NHS across all of our nations. And this is an intent to make a multi-billion-pound industry of looking after those who are in severe health problems. So I think it's important that we do challenge tonight what has gone wrong, especially within the NHS, because that is the healthcare system that was supposed to be the shining light in respect of how to deal with such things as a pandemic, how the test and trace has failed, the money that has been wasted, what risks are being taken now with herd immunity, with the extension of the vaccine. I'm very interested to hear from Professor Kalis on this, given the Imperial College study today, but also then to challenge what the health service will look like post-COVID. Are we going to allow the creep towards a marketisation of the health service? Are we going to allow fire and rehire in respect of those who've been at the front line in order to look after our nation through the biggest of challenges? And finally, Anne, I'll join in with Kailash in respect of paying tribute to Captain Tom today. And the reason why I think Captain Tom entered the hearts of all of us is that he wasn't going out and just clapping for NHS staff. He was doing something to try and help build the NHS, 100 laps of his garden as he reached the age of 100 to raise funds for the NHS. And I think all of us will reflect right now that we wouldn't want to entrust those funds with a Tory government or any neoliberal government that is moving towards the marketisation of the NHS. So I join Kailash in paying tribute to Captain Tom. Sadly, he's one of 1,449 people who perished today. That's 1,449 people who perished today because of the way that this government has responded to COVID. And none of us, and I hope we deal with it tonight, none of us should believe that this was inevitable because there were alternative ways to deal with this crisis, and other countries have followed those methods and they've saved lives as a consequence.
Yeah, thanks very much, Howard. I think that resonates with every one of us, absolutely. We're going to kick off with some questions now. So we're 20 minutes in, and we've got some questions from our members that, again, were submitted ahead of tonight's call. Could I come to yourself again, Marie, just, and Stephen, I suppose, and the question is around positive campaigns. Now, I know at your end, in the Republic of Ireland, Marie, there is a two-tier health system. It's quite similar to England in lots of ways. But can you share a wee bit about the campaign? I know there's a campaign with hospital cleaners, is it?
Yes.
Your area. Tell us a wee bit about that, Marie.
Last year, in our local general hospital, had to go on strike under really inequality and justice reasons, because Momentum, who there was contracted to hire cleaners in the public service, changed their terms and conditions without any negotiation or anything. So, and that meant way worse working conditions altogether. The staff wouldn't have enough cleaning products, they had to share products, and it was just, you know, really not doing the hospital any service. Momentum have some of the contracts in the public hospitals around the country as well. So it was just in Waterford, but they brought people by bus each evening or each shift, put them up in hotels and got them to go in and work in the place of the strikers. They brought them in through a back door. I was in Waterford and I clearly saw this, the bus coming in at 4 o'clock in the evening and all the workers coming off. And I'm sure they were probably getting a worse terms and conditions than even the regular workers were. So like our campaign really is that cleaning should not be subcontracted anyway in the health service, in the public health service. And all cleaners should get the very same as public sector workers. They should have a right to a pension, and they'd have the same terms and conditions, because they're the hub of the hospital, really. You know, if the hospital isn't clean or the setting isn't clean, it works all the way up and all the way down. So it's so important that these people are treated with the highest respect. And, you know, some people have the view of cleaners that they're almost indispensable and they're only cleaners. They're not. They are so important in our workforce, massively important. And so particularly here in Waterford, we're constantly campaigning. Unite in the Republic of Ireland, we have right to change policies, and one of the right to change policies is a right to health. So that's where we come in about our one-tier health system and free health for all. It's a given, you know, you shouldn't have to think about it anymore, but unfortunately there's such a big divide. And, you know, people wait for years upon years for hip operations or whatever on public health. And yet if you pay for it, it's done in no time. Also, you know, there is last year during the lockdown, the public hospitals took over the private hospitals, but they weren't really used. There was only one hospital really that was used. And then after a little while, the row started breaking out with the private consultants against the public, and it just fell apart. So the government stopped renting those hospitals then again, which led us to back to our two-tier system. So for about 6 weeks last year, we did have a single-tier system in Ireland. But I believe patients that went to hospital, and I know somebody particularly that had to go to hospital in an emergency after surgery into the public general hospital, and they were asked if they had private health insurance, and they had, and the private health insurer was charged for that visit, which is just, it's a roller coaster.
Yeah. Yeah.
And, you know, is one of our right to change policy principles, which we're very proud of here in Ireland, our principles. And as I said, right to health is a given. In my own workplace, which is a tiny workplace in the health sector, our laundry is going to be subcontracted out now. We did have staff in the laundry, but now that's going to be subcontracted. It's just like you're saying about the NHS, it's creeping in here more and more. Everything is being subcontracted.
So
maintenance is subcontracted just all the time.
No worries, Marie. Just your internet's coming in and out.
Oh,
but I think
sorry.
we caught, no, it's fine. It's overall, it's quite good, Marie. We caught the gist of what you were saying anyway. And I suppose it's just to ask you about, so is your contract up for renewal every couple of years then?
I'm not a cleaner per se. I work in the public sector, but those cleaners, their contract, yes, cleaners in Ireland, in all of the public hospitals are contracted.
Yeah.
They're not employed by the public health sector.
No, they're not. Yeah.
So depending on who gets the contract, their contracts are to be, you know, predetermined again. And naturally, they're going to come in and try and get away with whatever they can and change terms and conditions again for the workers, you know, not realizing how important they are. So that would be one of our main campaigns, you know.
Okay, so how's that campaign going and what support have you had?
To have recognition of cleaners in public sector, yes.
Okay. How's your campaign going, Marie? How's that campaign going and what support have you had?
Well, Unite are immense support altogether, and we have great officer. We have Jimmy Kelly as well in my area, who is he's a really good driver and gets us all going. I'm branch secretary of my branch here, and I'm also on the IEC. So we generally talk about those things, you know. Unfortunately, at the moment, there's no campaign going about anything because COVID has taken over everything. And it's just so important for everybody to get over this, I think, you know. But all those little changes, we've a public sector pay agreement on the table at the moment. it's a sweetener is all you could call it. You know, it's not bad enough that you say no way, but it's definitely not good. And the worry we have now is everybody has taken on so many more roles during COVID, extra cleaning, extra everything.
Yeah.
And are they going to be part and parcel of our job description going forward? In the pay proposal, it says no, but I wonder how we're going to cope with employers on that. You know, lots and lots of extra duties. So, you know, after COVID, I don't know where we're going to be. I'd say unions have big fights on their hands. Yeah.
Yeah. Thanks, Marie. Stephen, could you just tell us a bit about the campaign again that's kind of been sort of taken forward by paramedics, I think, around vaccinations? Tell us a wee bit about that and how that's going in your area.
Yeah, thanks, Anne. This was something that we became aware of through the Scottish Health Risk, you know, so the committee that Ewing and I are both on. And I guess there's an inconsistency across the different health boards in Scotland as to how each organisation is rolling out the vaccination of staff. And you know, while yes, NHS NHS workers are sort of split up into those who are patient facing and those who are not, and it's almost there's this sort of view emerging that those who aren't patient facing are somehow less important. And actually, as Marie's just described about the importance of cleaners, actually our colleagues in the Scottish Ambulance Service, very quickly realised that the paramedics, the men and women, on the front line, manning the ambulances, were absolutely getting the vaccination, but actually their call centre staff, who are the ones that actually take in the emergency calls and then direct the ambulance drivers as to where they're to go, weren't due to get vaccinated. So as a result of a sort of local campaign within the branch, they managed to overturn that. And certainly, as I say, at the last risk meeting, it became obvious that different parts and different places in Scotland are dealing with this differently, which for a country our size and considering it's meant to be a national health service, that just doesn't seem right. So I guess a bit like Marie, it wasn't a campaign in the sort of pre-COVID, sort of sense of it, but certainly there was members, gave us the issue, and activists then, sort of escalated it and got a result, which is the important thing.
Positive. Yeah, that's really positive, Stephen. Excellent. Again, I suppose it's just that bit. You've kind of mentioned something that we would all agree with, that across all the nations there's the kind of variance of how it's implemented or who gets vaccinated, who doesn't. Can I move next to Professor Kailash and Obeda? First of all, I suppose it would be to check with yourself around your views on. Members have asked what your views are on outsourcing of NHS contracts for PPE, as well as the proposal which you touched on, Obeda, around the second vaccine being delayed and sort of going off licence. Maybe go to yourself, Professor, first, just to see what your views are on that, and then to yourself, Obeda.
Am I going first? Sorry.
Yeah.
Oh, sorry. Yeah. So in terms of the second, delaying the second dose, I'll pick up on that first. I can see the benefit, as I said earlier, I can see the benefit, but let's not forget this, having one vaccine is just about tallying up the numbers and making it seem like they're vaccinating more people, but the reality is it's half a vaccination, and you're only receiving a full vaccination with the 2 doses. And people are going to start thinking, okay, I've had my one vaccine and I don't need to go out there. I'm all right now. I can get on back to normal. And that's a big risk for me. But it's typical of the way the government is operating. It's about flashing numbers and diverting people from the real issues, I guess. My concerns about the vaccine are the fact that, like I said, you delaying the vaccination means that you can open up for resistance for the vaccines, and that's really dangerous. And in terms of for the vaccines to be successful for everyone, we need everyone to take the vaccine. And if people start losing confidence in having the vaccines because they hear stories of resistance, or it hasn't worked for so-and-so had one and it didn't work, we just can't afford it, it's going to throw the whole program out. And I think it's a really risky strategy and we need to be careful.
Okay, thank you, Abeda. Professor Kailash, again, just over to yourself on PPE NHS contracts being outsourced, and as Howard said earlier, the potential marketisation of the NHS. Could you give us your views on that, for example?
And yes, let's look into the context with the COVID. Where we are today, more than 108,000 people have died in a country where we are proud of our NHS, in a country where we're proud of our scientists and researchers. Two things have happened in my view. One is we were never prepared for this, despite the fact that in 2016, there was a Cygnus report. That report was not anticipating coronavirus epidemic, but that report was essentially to prepare us for any pandemic. And that clearly talked about how many beds we would need, how many nurses we would need, how much PPE would we need. All those things were absolutely, I've seen that report, and that report is a very clear cut that what you need in an event of an epidemic. We didn't do anything. The second thing, we are here where we are is because of mismanagement. We all know we started this pandemic, went in late. Boris Johnson's mixed messages, confused messages, and was trying to confuse public. He was the one started with this. Yes, I've been to a hospital and been shaking my hands with the coronavirus patients. So what kind of message that was giving? Then, in my view, what you talk about the contracts is this public health crisis was perhaps one in lifetime after 100 years. Spanish flu in 1919, and then we had this. And this crisis, as a matter of fact, became an opportunity for privateers. Now, look at how the PPE, they knew they don't have PPE, and then they wanted to get the PPE, but not PPE from the real people who make PPE. It was something nobody even knew about those firms. The contracts were given to those companies. And we know even one contract was given to Turkey, if I understand, if I remember correctly. And that was a loss of 150 million pounds. And you know, and I know what exactly happened with test, trace, and isolation. 12 billion pounds of money was totally given in the drain. I've been shouting and screaming right from the word go that this kind of thing should have been done locally, done by very efficient local authorities, very efficient primary care, and the social services. These people who have conducted that social, this trace and isolation and support system much more efficiently and brilliantly at much lesser cost. But we failed because we failed in this test, trace, and isolation. And we know now, I think the success story perhaps in all this is vaccinations. True, this vaccination again, because we trusted NHS family, we trusted our scientists, and this is a success, not because of the government, despite the government. We have to learn many lessons. And in my view, once this COVID is over and done with, we need not a public inquiry the way normally public inquiries are the way of the governments to put it in the green grass or the long grass. We want an independent public inquiry. Any person who has any morality or any shame, I think by now what has the things have happened with these many deaths, Boris or Health Secretary should have resigned. And there are definitely better people who could heal and deal and handle with this much more efficiently and better. So let's keep our finger crossed. At least vaccination phase goes smoothly. That there are also problems, as people have pointed out, particularly Pfizer and biotech vaccine. The gap of the 12 weeks was unnecessary. There was no need for it. Or they should have started knowing it, what exactly they're getting into. And now the supply also with the Brexit, with AstraZeneca, EU coming in, all politics rather than actually efficiently delivering it. So I think I'll go back to that. Vaccines are a success despite them, not because of them.
Thank you, Professor. That's excellent. Howard, again, touching on that, has the government put profit before people and safety?
Well, Undoubtedly so, and it's the reality for all of us is this is capitalism that has gone into corruption. The emergence of people like Dido Harding and the companies such as Serco, and the inefficiencies. There's only so long that you can give people the excuse of stupidity or inability. At some stage, you have to decide that it is more than that, and it is undoubtedly more than that. There is undoubtedly corruption in respect of this, and people have got contracts that they simply haven't delivered, and whether or not that's intentional or negligent doesn't really matter at the end of it. I think Professor Kalis is absolutely spot on in respect of the test and trace element of this. You know, we are now into an argument as to who deserves the vaccine first. Which frontline worker deserves the vaccine first, and obviously the likes of Stanley Johnson got his vaccine, including the second jab, somewhat early. But we should never have been in this argument. We only have to look at the example of Perth on Saturday, Sunday, where they had one case in Perth. They have 2.6 million people in Western Australia, and they shut the entire city down for 5 days. The local news put up 19 venues that the one person had been to, and every individual who had been to those 19 venues has to go and get tested immediately to make sure that they've not contracted COVID. That is test and trace working, and it didn't cost £22 billion of taxpayers' money to make it work. So I think what we're hearing here is this systemic problem of an NHS. And again, Professor Kalis is absolutely right that there was no model for this in the first wave. So to some extent, there was an excuse for the first wave, only to some extent, Dan, because there can be no excuse for Madrid being locked down, but Madrid fans being flown into Liverpool for a football match. There can be no excuse for Cheltenham going ahead. Things that have to be looked at afterwards because they have cost lives in respect of it. But there can be no excuse for the second wave. Absolutely none. It was the 17th of March, whenever the World Health Authority said test, test, test. And here we are, almost a year on, still without a test and trace facility. And people are dying right now in the second wave as a result of the government's failings. And that's why we have to shine a light on it and ask for more coming out. Can I just finish by saying this, just a shout out to Marie and her fight in Waterford. My mum's from Waterford. It's an incredible struggle that she's going for. Jimmy Kelly obviously is at the forefront pushing for it. And Marie is absolutely right that we cannot see the outsourcing of cleaners or any other providers to the NHS. It all must be in-house, including care homes, if we are to provide what was Ernest Bevan's vision in respect of a health service for all. And we have to fight for that now. Whenever we talk about 115,000 people dying as a result of the COVID crisis, the only thing that would do justice to their memory is fighting for an NHS that is free at the point of care and has workers employed within it across all of the nations of the British Isles. That's the only thing that would do justice to Captain Tom and the others who have died as a result of COVID.
Absolutely.
Excellent, good point. Thank you, Howard. On the point of who gets the vaccine and that sort of subjective approach, I suppose, let's move now to a question again from our members who have asked, is there a change in attitudes towards health workers emerging? And I'd like to ask Alison and then Ewing, you know, do you think there's information that suggests that, you know, staff are now taking the brunt and they have gone from hero to zero? You know, without clapping for them 1 minute, and now there seems to be some suggestions that the tide is changing and it's more negative and sort of bordering on a blame culture. Alison, at your end, first of all, anything that you want to add on that?
Yeah, I think we see very negative comments on social media that we've had in our own hospital at Wrexham. We've had certain groups, shall we say, of people going into our hospitals and filming and approaching staff saying that the hospitals are empty. There isn't COVID in the hospital when the hospital corridors are empty because everything's going on in the wards trying to save the COVID patients. So we've got a minimal amount of outpatients going on and obviously no visiting. So that's why they're empty. We've had to employ extra security because of that as well. So obviously that's costing the NHS. we then come to the vaccinations. We've had, I think because of the government's attitude, as we can see towards the NHS really at the moment, then the public's attitude is definitely governed by that. We see some positivity with the vaccinations, but we do have people that are trying to cheat the system and get their vaccination when it is definitely not their turn. It's not surprising because people are scared, but I think that comes from our government not being clear and not being supportive enough of our NHS staff, to be honest.
Yeah, top down, really. Yeah.
Yeah.
You've got some really kind of obviously concerning examples. Do you want to share with us again your view on that? And
yeah, absolutely. And obviously it's from a Scottish perspective. So I suppose if you start off last year when we had the clapping for heroes and we had the rainbows in the windows and they've all disappeared. Yep. And then we move forward, particularly in Scotland, when the SNP government announced a £500 bonus for NHS staff. Was they asked for? No discussions with Unite or any other trade union. It was just awarded. And the public viewed that as, why are they getting it? Why not me? I work with social work, I work with local authorities, I'm a police officer, I'm a fire officer. And that started to divide the public services. And the public, you could see the public shift towards, why is it them? You move that forward a wee bit and you look at the vaccines. So we're getting constant complaints because staff are getting vaccinated. The reality is, if you don't vaccinate the staff, you don't have people to look after you. That's the bottom line. Plus, that was the government's decision. Same applies to testing, why are certain staff get tested and not everybody, and why the public don't get tested. And it's about the routine testing. I was shared with information concerning Police Scotland, and they were explaining about how they broke up illegal house parties, issued fines, and I cannot condone anybody who goes to these because they're putting their members' lives at risk. Yep, and I could not condone it. However, Police Scotland seem to take this thing that they want to report it to the employer because they see key workers should know better. We're members of the public the same as everybody else. They're our members. Let's be upfront and honest about it. So if I get a fine, that's my problem. But if a registrant gets a fine and then it's reported to the employer, they'll potentially lose their registration. And it's a two-tier workforce because not everybody's registered. So that for me is a huge change in attitude of the police. Part of my day job, I sit in a national committee which set up by the Scottish Government looking at compliance. For me, that would suggest that there's evidence to suggest that staff are non-compliant. And at the meeting last week, I asked to see the evidence that would suggest that, and government couldn't provide it. But there was a member in that who was pushing to use CCTV to monitor staff's movement, staff's compliance, whether that be social distancing, hand hygiene, whatever it may be. He then went on to describe how it might be worthwhile using body cams on staff to make sure they're compliant within the workplace. I obviously gave the clear answer, no, nay, and never. It's not going to happen. But the fact that government are thinking along those lines suggests to me that government are changing their position. They're looking for somebody to blame. Now, if staff were non-compliant, particularly with government, I would expect to be able to see that data because I would expect to see proper investigations, proper reporting of it, and that doesn't exist. And that to me is a huge worry for us. And I know hopefully we're going to be able to have a discussion on about RIDDOR, but I think that change within government, within management, and within the public, they're looking for somebody to blame, and it just happens to be us. So that's my huge concerns. And yet there's a step change in how the public are viewing NHS staff. Okay.
I think I speak on behalf of everyone here when you mentioned about CCTV, I think, you know, the hairs in the back of my neck stood up. I think it's a bit concerning to say the least. Anybody want to add any further comments to that? Again, that's a really good contribution from yourself, Alison and Ewing.
Well, and I just say that, you know, it's absolutely spot on, isn't it? This is the blame game, and it's moved consistently by governments throughout this. We're going to be told that it is of our making. It was, you know, it was young people who were told that they'd created the virus circulating whenever they went back to university, when all of us knew the reality of returning young people to university. But at the same time, workers were being forced into the workplace. You know, we had food factories where workers were up against each other in the workplace, and then people were surprised whenever these became hotspots for the virus to go forward. And then young people were told, obviously, not to hug their gran. And the reality, obviously, is exactly as Kailash said at the outset of this, that we had a Prime Minister who was going out shaking the hands of COVID patients, telling us all to have a pint as a civic duty, eat out to help out, and then suddenly we all get blamed as a result of this. And now the movement is to workers within the National Health Service. And I think the message that has to come through loud and clear from this is that unions won't stand by and accept it, that if they want our service after COVID, then there's going to have to be a new deal. And that new deal is one word, is respect for us. And that starts with those workers who frankly have saved the nations coming through this crisis, put their lives at risk.
Yeah, absolutely, well said. I think the next question, you mentioned Ridder, and I want to come back on that after this question, if that's okay, because I think that's a really good point. We can sum up and kind of conclude with that. Howard, again, just on the position of pay, we talk about health and social care staff, you know, we can't really see, you know, one group without the other, to be honest. During this pandemic, it's been evident that, you know, staff across these sectors have worked extremely hard. And the question, again, from the membership is, what is Unite's position on a pay rise for health and social care staff? Should the UK government open its wallet in recognition of a decade of austerity, but also recognising the work that the health and social care staff have carried out during the pandemic? I think we know the answer, but again, it would be good to hear from
well,
the
yeah, we do know the answer, and of course they should put their hand in their pocket, and those workers should get their 15% pay rise. But it shouldn't be the only demand, Anne, and it's not the only demand. Obviously, we want to see care homes within the NHS. The idea, and it is an absolute scandal once again, and probably worse than that, you know, it's tantamount to manslaughter. The idea that patients who had COVID were discharged to care homes, making those care homes effectively into nothing more than places for people to die. It was an absolute disgrace. And only today, Anne, I heard that there are student nurses who are still working on the front line. Yeah, amazingness, who are asked to be living on bursaries. Obviously, the government getting away with it because they're defined as student nurses. Bursaries of £500 to £700 a month, meaning that they are being paid £5 an hour for being on the front line, dealing with COVID patients and putting their own lives at risk. The governments have allowed them to have a death in service benefit. So if they happen to die because of their service, then they'll get a benefit, or their families will get a benefit for that. But in the meantime, they're going to be paid £5 an hour for front facing and caring for those who are suffering from COVID. So those types of employment practices have to be exposed. And I'll finish with a shout out to those members they're not our members, but those members who are fighting at Heartlands Hospital in the West Midlands, porters who were clapped, as Una said, on an April night, and then fired and rehired on a December night, told that their routers were going to be changed, and effectively now they're sleeping to work. That's effectively what the change of the routers is. And if they don't want to accept it, then they're fired. And just outrageous employment practices that COVID hasn't created, but it's shone a light on them. And in that it's shone a light on them, we have to make sure that we pick up the fight for our members after this crisis.
Absolutely. Okay. Well, I think looking at the time, I think that's all the questions that we can take just now, but I would like to ask Ewing to kind of talk us through and share the Ridder guidance, because I think this is something that's really important. Obviously, reporting of injuries, diseases and dangerous occurrences regulations relates to in the workplace, and COVID is obviously the kind of relevant discussion here, and what can we do continuing to support our members around this guidance and subsequent recording?
One of the problems, Anne, is, and it goes back to, and Howard made the point about death in service, but if you're unfortunate to contract COVID and you develop long COVID and it's not properly reported, then your claim for industrial injuries is going to go nowhere in reality. And if you look at the prevalence within the staff, and I'll take my own health board, so we've got over 1,600 members of staff who have been contracted COVID. Only 42 ridders have been launched. Now, it'd be reasonable to assume that if you're working with COVID patients, that your likelihood of contracting COVID is far higher than any member of the public. And that would bear out by that statistic of 16-17% infection rate. But I think the reality is, when boards get around to doing these investigations or datexes, staff are really apprehensive about putting their head above the parapet. Because when they're asked the questions, if you're unfortunate to work in a ward with an outbreak of COVID and you've got several deaths, it's very hard for staff to say, yeah, I can pinpoint where the mistake is. And I don't think that they've been given the opportunity for Unite or any other trade union to sit in with them during the investigations. I don't think they're getting the support for the trade unions, and I don't think they're getting support for the management. So, and it goes back to that blame game. Staff are really, really apprehensive. So the guidance is there, and it's about where there's a likelihood of that industrial injury or industrial disease taking place within the workplace. And if you're working in a COVID ward, I would say that's a reasonable belief. I had an example where there was an outbreak and there were 30 members of staff who contracted COVID in the one ward. One red order was reported. That's just not acceptable. So I think we need to get the message out to our members to say, if you're unfortunate to contract COVID, make sure it's, and there is an outbreak within your department or within your hospital, make sure it's datexed, make sure it's reported, and inform your trade union, because it's up to us to fight to make sure that that investigation takes place. It's up to us to make sure that the learning, because if there is non-compliance, and that could be by the boards or the organisations who employ them, to make sure that that's shared. But I don't think your members have been properly cared for. And I think it's up to us to launch that campaign to say, we've got your back, we'll support you. That's our role. We'll make sure that you're properly represented, but we need to be in the room to make sure that. So we need to let the employers know that we should be in the room. We need to let the members know that we're happy to be in the room. And we need to let the members know that we're there to protect them. Because I don't think the organisation, it goes back to that blame game. If we can blame the individuals, then that moves that possibility of claims away from the employer. So I think we need to lodge a campaign about communications with our members, and that has to be a local thing, because staff, our members and our reps need to be in touch with these individuals, because we know where it happened. And I just don't think we're doing it very well.
Okay. I think you mentioned 1,600, Ewan, given that only 42 were reported. I mean, that's ridiculously low, isn't it? It's like 4 or 5%. So do you think there's a kind of bit of both? Because again, being a nurse and I was familiar with completing datexes and I knew what ridder meant, but I think that was part and parcel of being probably an activist and obviously knowing policies, etc., but also having maybe a good line manager. So is there a bit there about this is a positive, because it's also about the organisation. It highlights trends, it highlights issues. It's information that, Alison, you've worked in informatics and governance, haven't you? I mean, this is important for the board no matter what. But also, I think what's really important as well is near misses. So it's not waiting until you've got COVID, right? It's that culture of, looking at things in a way that if anybody else was to come in here, that's happened once, it could happen again. Minimising risk, mitigating risk. So I think it's a really good campaign, and I think there's potential there, to be really positive as well.
It goes back to the start of the pandemic. And that risk assessment process was never carried out within the workplace. Never carried out. I'm talking about COVID-specific risk assessments. And therefore, staff weren't aware what they had to look out for, nor were they fully aware of what the intention was going to be. Now, there is a general rule of thumb that in a pandemic, that type of thing would not be read or reported, because the transmission is within the communities. But if you start looking at wards where you've got high levels of concentrated outbreaks, then it's like saying a fireman's unlikely to get burnt because there's 10 fires. No, that's not the case. It's nonsense. So if you've got 1,700 members of staff who have contracted COVID, it's reasonable to assume that some of that is going to be workplace related, but staff need to be aware how to take that forward, but also how to get their support. And I don't think we've done it very well at the moment. I think we can turn it on its head.
Yeah. So have we got links on our social media, Ewan, about the guidance so that we can give it to our members and keep them updated?
Yeah, I think Lorna shared that this afternoon, and hopefully we'll get that out as far and wide as we possibly can. Yeah. I think we can get it out to branches. I think we can take it into the NISC and into the risks to make sure that's taken into the workplace. I think we need to get our health and safety reps fully organised so that they can go forward and challenge the employer where they haven't carried out RIDORs or proper investigations. And it goes back to that question about non-compliance. Shows the evidence, because the only way you can show the evidence is by doing the investigations. And if you've got the evidence, that would suggest that there's a flaw within the workplace. So it's a chicken and egg situation for me. Yeah.
And again, just to add, there's a wee bit about, like, a lot of staff have been working from home where they can. So if you think about NHS staff, there's a lot of home working risk assessments that need to be done, and it's part and parcel of that bigger picture. But you're right, the long COVID is a concern. We're learning more and more how, you know, it affects staff and their, you know, how it affects, you know, health for everyone that contracts COVID.
I think the working from home's a huge issue for us, because people were sent home last March. We're getting a laptop and a telephone, and away you go. And we didn't think it was going to be for this length of time, but we'll get people who are sitting in the wrong posture, i.e. guilty as sin. We're at a computer for 8-9 hours a day. We're not taking natural breaks. We hadn't done a risk assessment about the display screen, and we just hadn't followed that up. And I think we're creating potential musculoskeletal problems for our members in the future. So, and again, that's another message I think we need to get out there to give them some advice about taking breaks, making sure they've got the right equipment. And it's not just about a phone or about a computer, it's about the right seat, the right desk. And I think it's shocking that the health boards have allowed that to happen. When we raise it with the employer, you get flippant answers. And I don't think that's acceptable, and I'll be honest.
Okay. So thanks for highlighting that, Ewan. I think we'll definitely get links out in social media, get it up in the UL and Unite web pages, etc., and certainly get our members involved. So again, I think just before we kind of wrap up, Professor Shand, is there anything that you would want to add before we kind of summarise and conclude? We've got a few minutes to go, and it would be great to hear any comments overall from yourself.
One point, Anne.
Yeah.
I think it's not scaremongering. I think it's the truth. The morale of the profession overall of NHS family is rock bottom. We know, you see, ICU, for example, we didn't have so many ICU which were required. They have expanded ICU, but there wasn't any staff. If in ICU, one nurse was supposed to be looking after one patient, now one nurse is actually looking after 3 patients. They are mentally and physically exhausted. And if their working conditions are not improved or not done anything about it, believe me, it's again not scaremongering at all. People will walk with their feet. Yeah. And that's happening with, I know there was a survey done very recently by BMA. Would you believe it? 1 in 4 doctors is mentally depressed. If that is the situation, how NHS is going to work and move? We have to really look into it. And this is a warning to this government that, for God's sake, not just doctor, nurses, whole NHS families, working conditions and pay got to be improved if you want to keep NHS running. Or maybe they have different ideas. They don't want NHS to be NHS. They want to bring in the private sector. If that's what their agenda is, then God save the NHS. Thank you.
Oh, thanks, Professor. Okay. Just to conclude, I want to thank all the members that sent in questions, really, really great questions for our speakers. Again, thank you to all our speakers. Final words, Howard, anything you want to to sum
well,
up.
just to thank you, Anne. Just to thank everybody who's on the Zoom tonight and everybody who's watching. We are facing a crisis after COVID, and at the same time as obviously facing the COVID crisis again. Professor Kalis, couldn't agree more in respect of the fact that right here and now, NHS staff are putting their lives at risk because they feel a sense of duty to do so. But after this crisis, watch the exodus from the service whenever staff realise that they have been used in a way that is quite inhumane at a time whenever we should all be respecting them and all be giving them what they deserve, which is better terms and conditions, a pay rise and respect in society. We need to reboot society after this crisis, so as those who care, those who teach, those who clean our streets are respected by all of us going forward. We do have a fight for what is an NHS, what is a health service across all of our nations in the British Isles. And that is a fight that says that you get free healthcare whenever you need it, and that there is direct employment, and that we resource the health of our nation. We do not profiteer from the health of our nation. And it's a fight, as Owen said, that we must all take up after this crisis.
Thank you.
Thanks, Howard. Absolutely spot on. And I think it was really good to hear from everyone in all, different parts of the countries. We have got a lot of commonality, and as Howard summed up there, I think the pandemic has taught us that we can't privatise the NHS. It's really important that we kind of move forward with, this sort of consistent approach that's a kinder approach and a caring approach towards every member of our kind of NHS and social care family. Thanks to all of you tonight. That's time up, folks. So hopefully we'll have another one of these, but brilliant.